maybe it's crazy to say, but in the future, we may be using GLPs as another kind of arm of hormone therapy.
Hello and welcome. Today I have Jackie Giannelli. Jackie is a board-certified family nurse practitioner specializing in women's health with extensive expertise in hormonal health, menopause, women's sexual health, and urogynecologist. Welcome, Jackie.
Hi, Karen. It's so nice to see you here. You and I have known each other a long time, so I'm thrilled to be, connecting with you on this platform.
Yes, it is funny how the world goes around and everybody comes back together somehow, no matter how big it is, it's small.
That's right.
So I was looking through some of your materials, listening to your podcasts, and I heard the term millennials. What is millennials?
Sure. So millennials, right, as we know, there's different generations. So the Gen X generation, which is, I'm actually right on the border. So for me, I turned 45 this year. So I'm just like stepping my own foot into, my technical perimenopause era. But I was born in 1980, and that sits squarely, right between a Gen Xer and a millennial. And what we're seeing now is this second wave of perimenopausal women kind of learning and growing and trying to understand perimenopause, and they're millennials. And millennials think a little bit differently than Gen Xers do. They grew up in a different time. They had iPhones, at the ready, and so they're experiencing perimenopause, I think, with a different lens. And so the term for them is millennials. It's this, the earliest babies in perimenopause, if you will.
And so are you really seeing, I hear it a little bit more, but I still feel certainly in the baby boomers and Gen Xers, there's still a lot of shame and embarrassment and not talking about it and misinformation and no hormones and causes cancer and the whole thing. But what I'm hearing is that the fact that there's even a term millennials actually makes me feel good, because it means that there's this new generation or younger generation that's actually embracing menopause. It's just one of those things that we're all going to experience. Is that what you're hearing?
Yeah. So a few things I'm hearing. First of all, we know now and are acknowledging more publicly that perimenopause starts 5 to 10 years prior to the years leading up to your final menstrual period. So if the average age of your menopause in this country is 51, give or take, and you do the math on that 10 years before, now you're looking at, 40, 41 to start to show the first potential signs of perimenopause. And so women who fall into this millennial generation are hearing that, and they're using it as a rubric for which to understand maybe how they're starting to feel a little bit different. They're, maybe coming out of their reproductive years, perhaps having babies later in their 30s, looking around and starting to say, I think I'm, feeling a little bit different. I can't quite put my finger on what it is. And they're starting to ask the question, could this be perimenopause? So, that's a valid question to be asking, especially with this cultural zeitgeist we're experiencing around perimenopause and the sheer amount of information. It's like drinking from a fire hose right now when it comes to this stuff. And I do feel like it's a lot. And I think there's a lot of anxiety that the elder millennials are experiencing around this, just wondering, is this something I need to be addressing now? Am I just postpartum? It's this overlap of the reproductive and the non-reproductive years, and they're falling squarely in that. I think it's stressful, and there's a lot of information overload to layer on top of that.
How does having children later in life affect menopause? Do they know?
So I don't think it's necessarily that it affects your age of menopause or when you'll finally get your last period. I think what we're seeing more is that, we're seeing more, assisted reproductive technology being used. So where women are getting really high doses of estrogen for fertility treatments, for example. And then they're pregnant when you also have really high levels of estrogen kind of floating through your bloodstream. And then you're postpartum, and it's like falling off a very steep cliff into perimenopause from there. What the brain and the body does not like are wide, crazy swings in hormones, right? We like gradual changes that gives us our brains and our body a time to adjust and to sort of tap into that neuroplasticity that our bodies are capable of. And we don't really get that if we are, having babies later in life, and then all of a sudden we're entering perimenopause shortly thereafter. The brain kind of sees that as whiplash.
So in that situation, I would imagine that's a very strong case for someone to embrace hormone replacement therapy, the bioidentical kind. as opposed
Yeah,
to the
I think these are often the women that show up in our clinic
yeah.
because they're now very familiar with hormones and what hormones do and how they're tuning into the impact of hormone fluctuations on their body much differently than somebody would who had, babies when they were 25 and then kind of coasted through their 30s and, now is 45 or 50 and entering perimenopause. That's a very different experience than a woman who used, IVF and had babies at 41, 42 and now is starting to experience maybe not even cycle changes yet, but just that initial loss of progesterone, the first hormone to decline in perimenopause, can impact the way we sleep, can impact our mood. Now you've got a little baby at home, maybe you're working. Like all of these things can be very confusing and overlapping, and it's difficult, I think, for the regular woman to understand what's what.
Yeah, yeah, I can imagine. For the women who are not having their children much later, whatever the age that is not much later, but under 35, I guess, is the kind of the arbitrary cutoff. Are you seeing those women? What I hear is, I want to try something natural right away, non-hormonal treatments. Are you hearing people embrace hormonal treatments more? The younger women who are going through the regular trajectory of menopause?
I am. I am seeing far less hormone hesitancy than I ever have in my career. I don't know if that's a term I just came up with, but
I like it. It's a
exactly,
good one.
exactly what it is. In fact, it's quite the opposite. The pendulum has swung the other way. It's give me the hormones, give them to me now, and not the birth control kind, right? Give me all the bioidenticals, quote unquote. They're in a panic in a bit, and they're seeing women who are in their 50s talk about the benefits, rightly so, of estrogen on their acute symptoms of menopause and perimenopause and applying retro applying that to their earliest phase of perimenopause. And that's the thing. It's like hormones are they're very finicky little things. Like we have to have just the right amount at just the right time. And just when you have it figured out, perimenopause evolves and the game plan changes. And so there is no one size fits all. Estrogen is not right for everybody at every stage of the game. The same dose, the same route, the same timing, it's very personalized. And that's a difficult, I think, concept for women to understand because they're also used to being given a birth control pill that works for everybody, right? That is almost a one size fits all to a degree solution, and that worked for many years for many women. But perimenopause is such a different beast. So yes, I'm seeing that. I'm seeing that, and I'm also seeing potentially, okay, well, I want to learn about this stuff. Like I want to understand what these things do. I may not be ready to try them just yet, but I want to be prepared for when I do need them.
Interesting. That's great. And it's so important. And hopefully the medical system or the medical schools will catch up with their patients who are coming in, hopefully more educated from people like us.
Yeah.
Let's talk about non-hormonal treatments. I'm hearing everything from, black cohosh to, voodoo stuff. And now a lot of GLP1s are like the miracle drug. Let's talk about what the options are and how you start with supplements or whatever they are rather than prescription drugs.
It's a very meaty topic. Where I can give someone estradiol if that's what they need, and I can solve a lot of problems with one foul swoop. Estradiol, you have an estrogen receptor in every organ system in your body. And so in many ways, it is a lot easier for me to prescribe hormone therapy to people than it is for me to start doling out supplements and, asking people to switch up their lifestyle and their habits. Like that's actually much harder. So when people say I want to go natural, I'm like, okay, that's fine. And for many women, that's the right choice for them. And I don't judge, but it is a little bit more difficult because now you have to kind of go symptom by symptom, right? Because you're not going to have one supplement or one even non-hormonal prescription that's going to take care of all of the myriad symptoms of menopause that we know exist, and there are many. And so, when I think about, okay, how do I want to infuse a treatment plan for this person that's going to be effective and isn't, going to overwhelm them, I really try to hone in on kind of like the layers of this like pyramid, right? And for everyone, whether you're using hormone therapy or not, the lifestyle stuff, I know it sounds so boring to say over and over again, but it's so important. It has to be there and it works. And that's the thing, right? If you're still drinking alcohol to excess in your 40s, it's not, things aren't going to go well for you in perimenopause. And that's the sad reality, is that most women come to these terms with that they can't have, 3 or 4 glasses anymore. They maybe can get away with one and still get somewhat of a restful night's sleep. We do need to change the way we move our bodies, right? We need to go from often doing a ton of high intensity interval training and hardcore cardio to a more strength training focused regimen. We need to do more rest and digest type of movement, yoga, Pilates, core work is super important. We need to change the way we eat, can't get away with as many carbohydrates potentially or simple sugars as we used to, or even processed foods. And we have to get hyper focused on, how do we live in the everyday, because all of those things will improve your experience once you do start to use hormone therapy. Your hormone therapy will be so much more effective if you're doing all the right things underneath it.
Right.
And yes, and then of course, there are beyond that, then we move into sort of what are the over-the-counter, non-prescription, aka supplement type of interventions and modalities that we can start to layer in on top of that. There are, as you know, a bajillion supplements on the market in all different colors, flavors, doses, and making bold, wild claims about what they do. I think, to me, that is the biggest challenge for women in perimenopause, is navigating sort of the supplement landscape. It is well marketed. It is in your face. It is very easy to click and buy and have at your doorstep in 24 hours or less. And when you're suffering in the middle of the night, that's enticing. You have to get on the phone with your gynecologist, and maybe she can see you in 3 weeks. Well, I'm gonna, your phone hears you say that, right? And now they're spitting out ads to you. They know what you're Googling, and now you're going to get a bunch of supplement ads targeted at hot flashes or sleepless nights, right? And so the system is not set up for us to really, make great choices. So women do need to be aware that is like, the landscape we're all living in here. With that said, there are plenty of supplements that are great additions to anyone's perimenopause or menopause, treatment plan. And I use them in my clinical practice all the time. I use them for myself. It's not a this or that, right? We don't have to just say, I'm just a hormone therapy girl, or I'm just a supplement girl. Like, you can be all the things. And oftentimes that's the right way to go. There are plenty of supplements that have great evidence behind them, that are safe, that are effective, and low risk to try, right? So why not think about that?
And so let's name a few. I mentioned one or two that I'd heard of, but I don't know.
Of course. Yeah, I think there's a core 3 or 4, sometimes 5 supplements that I think a lot of perimenopausal women should think about using. I mean, not to bore anyone, but vitamin D3, often with K for bone health, is something that I find a ton of benefit for my patients and for myself. We want our vitamin D levels to be above, at least 30, sometimes even 40 or 50 if we're, taking more of a functional approach here. And that's important because many, many women and men are deficient in vitamin D. We just don't walk around without our clothes on in the sun anymore. Our soil does not have the same level of nutrition and nutrients that it used to. And we're eating differently. And so vitamin D levels, when they're low, you can experience immune deficiencies. I know, I have a lot of patients who tell me they were getting kind of like the common cold all the time, and they took vitamin D, and that really helped their immune system to function better. There's data, of course, to say it's helpful for your bone health, and even for mood, right? For things like clinical depression, right? It's helpful. So when you really can't also, it's a fat soluble vitamin. So it's stored in the liver. It's very hard to get too much vitamin D. It's possible, if you're taking a lot for a long time, but it's a safe thing to try to start, use it for a few months, use it for 6 months, and see if it's making any meaningful difference in how you feel. And that's a golden rule, I think, for all supplement approaches. Whatever you're going to try, really benchmark. Where am I starting from? What are my symptoms I'm hoping to address? What is the severity of those symptoms? And have reasonable expectations for what the improvements might be. Supplements are not prescription medications. You're very rarely going to see 100% improvement in any one symptom on any one supplement. And any supplement company that tells you otherwise, you should run away.
All right. So besides vitamin D, what would be the top 2 or 3?
Magnesium is excellent, of course, for the same reasons. Again, we just hard to get enough in our diet and our food. Magnesium glycinate is the most kind of widely recognized, gentlest form of magnesium. It can help with sleep for sure, and general anxiety and just general mood. I love B complex or B6 and B12. Again, very important for our neurologic health and for things like migraines, which many women suffer from, especially in perimenopause. I really do like, a little bit of creatine. I know that that's a hot topic lately, but creatine is a helpful chain of amino acids. We know it's helpful as women are trying to build lean muscle mass at the gym, making that strength training workout count. There's also reasonable data to show that creatine supplementation can have an impact on mood, things like depression, alongside things like, SSRIs and or cognitive behavioral therapy. Creatine has been shown to be useful, and it's safe, low risk, and relatively inexpensive.
Well, that's interesting. I just started taking creatine, so I'm trying to figure it out, but I heard that as well. That's great. I recently heard GLP1s in the same sentence as menopause. I know it's a weight drug, but how does it affect, how would one use it in the case of menopause?
Sure. So I think, just for categorically, we should say, okay, like moving into prescription, right? Prescription therapies, because there are many, right? When we're talking about perimenopause symptoms, classically, we've used things like SSRIs, right? Mental health medications like Paxil or Effexor in order to treat things like hot flashes and mood changes and sleep disturbance. And those, while hormone therapy was on its 20-year hiatus, thanks to the WHI, were kind of all we had. And so we know them to be effective, maybe 60 to 70% symptom improvement for things like hot flashes on an SSRI. Still an important tool we have. However, if someone's only symptom is hot flashes and nothing else, when they're a candidate for hormone therapy, again, you're weighing this like pros and cons.
Right.
We know the hormone therapy is the gold standard for things like hot flashes in perimenopause. We've historically gone off label and used things like gabapentin, which is otherwise called Neurontin, which can also be helpful for hot flashes. We have other non-hormonal prescription medications, which for sexual health, which I always like to bring up because not everyone can take testosterone or access testosterone. So we've got two great drugs actually that are on label for premenopausal or perimenopausal women for low libido. That is Addyi and Vyleesi. We don't have time to go into all that today, but both of those are non-hormonal treatments for low libido in women, and they work. And I would, kind of throwing in the ring here as a non-hormonal treatment, prescription therapy for menopause, I'm going to say GLPs. And maybe that's a controversial hot take or something. I don't know. But I have to tell you that for the last, 5-6 years, I don't see a woman anymore who doesn't come into my office and say that she's not experiencing some form of weight gain and or inflammation, right? It's not always that you've gained 15 pounds, although many of my patients do find that to be true. It's also just that I feel like my joints hurt, or I'm feeling more bloated than I did before, or my cognitive clarity isn't the same. My brain isn't working the same way as it used to. Inflammation is really a root cause of a lot of the symptoms that women experience in perimenopause as their estrogen levels are falling. Estrogen's anti-inflammatory, and we see global changes as a result. So I think a GLP, it truly is an endogenous substance that our body has made. So in many ways, it's not that different than a hormone, a bioidentical hormone, except it's not a hormone. It's a peptide. It's just a string of amino acids, and it works directly in our brain. It works directly in our gut. It works on our insulin receptors. It works in many different parts of our body. And we're seeing such incredible changes aside from weight loss, things like decrease in alcohol consumption, things like improvement in ADHD type of symptoms, improvements in autoimmune conditions, right? And all of that is super interesting because those are all serious afflictions that women in menopause are dealing with aside from the weight gain. So I love paying attention to the space because I do think, I don't know, maybe it's crazy to say, but in the future we may be using GLPs as another kind of arm of hormone therapy that is sort of standard and proactive and preventive. And I don't know, that's the framework that I'm thinking about using them in my clinical practice.
I did not know that. In fact, I'm going to talk to my doctor about them because the inflammation thing. I did hear that it reduces your sex drive, though. Is that true?
Yeah, so that's a topic that I've talked a lot about as well. So everything is dose dependent, right? Same Goldilocks theory applies here as well. When you're using the right dose in the right person, you get the symptomatic improvement you want with the fewest amount of side effects. But one of the ways that GLPs work is that they work directly in the brain to blunt that dopamine response, which is your get excited, start to like crave something. And if you're craving food and you're a hedonistic type of eater, someone who eats for pleasure, and you use a GLP to lose weight because, it's probably a miracle drug for those people, right? And you get up, you keep needing to go up on the dose and up on the dose to get to, whatever it is the weight loss is you need to achieve. At some point, you may flip a switch in the brain and turn off all of the reward response pathways that the patient is utilizing to find pleasure and joy in their life. And one of those might be their libido, their arousal and their orgasm. In fact, we've seen patients in my clinic who've completely lost their ability to have an orgasm after being on GLPs. And it's not just women, it's men as well.
And can they get them back if they go off the GLPs?
Yeah, they usually can. I mean, usually once it's the trouble is getting them to bring it up, right? Because many people are still ashamed and they're just so grateful and happy to be losing the weight that
Right.
the oxytocin and the buzz from that is like, well, fine, like this must just be a transient issue. I'm just going to ignore it or not bring it up, or I'm not that close to my doctor to be able to tell them that. And so I think if providers don't ask as part of their side effect profile, rundown,
Right.
it may never get brought up. So I do want to throw that out there to providers or patients who are listening, that if that's happening to you, absolutely, we can augment your therapy in a way that preserves your sexual functioning.
And does that happen at the very low doses as well?
It can, over much less likely to do so. I haven't really been seeing that at sort of starting doses. I also think it's the speed at which we titrate these medications. I think when we're like cranking up the dose, week after week, according to some sort of like standard protocol, and not actually talking to our patients about how it's
Right.
going for them, we do see that it's like, whoa, a shock to the system. But I take a much more gradual approach. I use lower doses for longer periods of time. It's not to say that I can't get up to the doses that are higher. I can. I just think the body, again, really loves gradual change. And
Yes.
that's the way you're going to keep the weight off anyway.
Yeah. Wow. That makes sense. So we talked about hormones, we talked about supplements, we talked about GLPs. Anything and lifestyle. Anything else I'm missing here?
Oh my gosh. Yeah, I mean, I think, the power of community, the power of listening to your friends talk about it in the group chat, right? Just like leaning on each other and, not necessarily to say like, well, what works for you, what might work for me, but just to kind of be a support system for each other, and crowdsource information and share referrals, and all that stuff is just so important to women. And it's like a pillar of our wellness that I don't think we talk a lot about. So I did want to throw that out there. And there are a lot of platforms out there that incorporate community into their pillars of their product for that exact reason, because we know that women rely on each other so much.
Yeah, and I think there's comfort in knowing someone else is going through the same thing that you are. But I do say caution in what information you hear. Make sure you do research because
Yes,
there's
exactly.
a lot of snake oil and a lot of people who don't know what they're talking about giving advice. I see
Yes.
people who are asking questions on Facebook. They should really be asking their doctor. So keep that
Yes.
in mind. But yes,
Yeah.
community is super important and definitely something that I am building as well. Well, Jackie, this has been unbelievable. Where can people find you?
Sure. So I am pretty active on Instagram. I am at Jackie.Giannelli NP Talks. I'm sure you'll link it somewhere because there's lots of
Yes.
letters in my last name. I have a newsletter called In the Saddle, which is really another place for me to have deeper conversations with women about what it's like taking this stuff and applying it in your real life, because I don't think that that's something that we've done enough of. I think women are really well educated. This podcast, there's a lot of great information. We're and no shortage at this point of ways to learn about perimenopause, but how to learn from the right person and then what to do with that in your everyday, I think is still something we're working on. So that newsletter is my take on real life, and my own perimenopause as well. And then of course I'm on LinkedIn. I have my own podcast called the Well Kept Podcast with my co-host Carmen, and we talk a lot more of the fun stuff like skincare, hair care, some of the more industry related topics around women's wellness. So just yeah, any of those platforms are where you can find me.
Great. And I almost forgot my last question that I ask every single guest. What is your definition of sex?
Ooh, my definition of sex is, um, I would say finding your pleasure and then owning it. Because I think sex is very personal to everybody, and there is no one definition of how to feel sexy. And so I think that women really that's something they need to figure out for themselves and then own it and let no one else try to tell them how sex should be or should feel for them, because there is no one size fits all sexual experience or form of sexual pleasure.
Great. Thank you so much. So great to see you.